Great.
Thank you, Kia. Welcome, everybody. Thank you all for joining. We've just opened up the room and we have a lot of people coming into our Zoom room. The great thing about the Zoom room today is that all of you will be staying dry because outdoors it is raining, and indoors, I hope where you are, you're dry and comfortable and getting settled. And as soon as we let more people in and everybody gets the numbers slow down, we'll get started with the meeting. We do have about 700 people coming in today who have RSVP'd. And we all are in the same room together. So we should have you entering on mute, but if for any reason don't find yourself on mute, we do ask that you mute yourself during our presentation so that we can make sure that everybody can hear the speakers. So welcome, and Kia, when you tell us that it's slowed down, we will get started, okay?
Sounds good.
Thanks, Kia.
I recognize so many names.
Welcome to everybody who's just joining. We'll be getting started in just a minute or two. We're having everybody come into our Zoom room and get settled. And as soon as the numbers slow down, we'll get started so we can be as prompt as possible and make good use of our hour. We do have a large group with us today, which we're thrilled about. We do need to ask that everybody go on mute. If you're on your telephone, please either mute through your phone or through the Zoom application if it's open on your phone. And if you're on the computer, make sure that you're muted. We will try to make sure through our hosting that we mute people who are unmuted, but we need to ask everybody to help us pay attention so that we can hear the speakers. Kia, you let us know when we're ready to get started.
The numbers seem to be steady at this point, in my view.
All right. Kia, are you good if we get started?
Yeah, we can get started. We have a steady flow, but it's like 5 people at a time. So I think we're good to go.
All right. Well, welcome everybody. Good afternoon on this rainy Thursday. We hope you're all comfortably warm and safe somewhere. And we are very grateful for your time that you're going to spend with us in this next hour. We hope we'll make good use of it together to further our work. My name is Deborah Cornavaca. I'm Deputy Chief of Staff to Governor Murphy, and I'm honored to be here with my colleague Kia, with Kaylee and Lori and Casey and many others from the Long-Term Ombudsman Office, from the Department of Health, and especially with Bill, our host for today, to help us walk through an FAQ and to give us, I hope collectively, more clarity on where we're at and the information that you need to be strong advocates for yourselves and your families. We did meet, I think, a couple weeks ago, and we started the conversation. We said we would be back, and here we are. And this is just the next step. It's not a second and done. This is an ongoing project we want to be partners with you in, and we're incredibly grateful for all that you bring to the table in terms of real experience that inform us, and your understanding, your questions, your input, all help us be better at the policymaking level at the state government. So we are incredibly grateful for all of you. We are also want to acknowledge and express our gratitude for how difficult this has been. And we know it's been incredibly difficult for family members and for residents. And we are committed to partnering with you through this to get us to a better place and to work through the difficult challenges together. So we hope today will be the next step in that. And we are grateful that we have experts and partners like Bill in the room to help us. So with that, Bill, if I could turn it over to you to set the stage for us and get us started on the content, which I know we have a lot to cover today.
Great. Thank you, Deborah. And thank you to everyone from the governor's office that had helped make this possible. There's two people from the Department of Health that I want to first introduce that will be speaking today. One is Cassie Golizewski. She's the Executive Director of the Department of Health Office of Long-Term Care Resiliency. That's Cassie. And then the second person is Rebecca Greeley. Rebecca has a very long title. She's a team lead for infection control, healthcare, and environmental epidemiology, infectious and zoonotic disease program within the DOH Communicable Disease Service. So that's Cassie and Rebecca from the Department of Health. Number 3, the purpose of this webinar is to answer the most commonly asked questions. So in preparation for the webinar, we gathered the most commonly asked questions. And with the help of our long-term care ombudsman, Lori Facciarosa Brewer, and her team, she will be presenting the answers to the most commonly asked questions. We believe this is the most productive way to get all of us up to speed as fast as possible. Now, you will notice that the chat box is open for this meeting. I already can see there's a long question that was there. We'd like to use the chat box for short questions that pertain to what we're talking about at that particular point in time. That may be frustrating for you because you may have a specific issue that you want to get out there. The best way to work, and I advocate for my mom the best that I can every day, is I go to the facility when I have an issue. From the facility, if I don't get what I need, I go to the ombudsman, and then from the ombudsman, it goes to the Department of Health. That's sort of the best way to operate. The reason I founded the Facebook group called Face for Seniors, that many of you are a member of, is because we all want to be better advocates, educated, smart, advocate for our loved ones directly with the facility. And that is what this webinar is about, making us smarter, up to speed on policies that are frankly kind of hard to follow. All right, with that as the goal, I see some questions coming in. We'll do our best to answer them at the point in time, but these questions are actually, frankly, right on our list. So that's a good time for me to turn it over to our New Jersey long-term care ombudsman, Lori Facciarosa Brewer, and we can also bring up the PowerPoint document.
Thanks so much, Bill. I really appreciate it. It's an honor to be a part of this, and it's been an honor to work with all of these families through these many months and to work with Bill. Face for Seniors is truly a unique organization, really in the country. It just kind of grew up around this issue, and I'm always incredibly impressed by Bill Borelli, of course, but also his team, because you families really are part of his team now, and you've been very effective advocates, and I applaud you. So what we're talking about today is long-term care visitation policy. And what we're focusing on are two very important pieces of new guidance that came out in the last 3 weeks. So if we could move to the next slide, Keisha. Basically, what we're going to be talking about is the visitation memo that came out on March 22nd. And we did talk about that a couple of weeks ago. And then also quarantine guidance and a revised risk assessment tool from the New Jersey Department of Health that really affects primarily the issue of taking your loved one out of the facility for short periods of time for outings. Next slide, please. I mean, everybody knows, right, that, you know, visitation shut down on March 13th, 2020, and the state of New Jersey issued resumption of services plans, multiple resumption of services plans and reopenings over the course of the last year. But throughout, there have been 4 kinds of visitation that have been allowed, okay? End of life speaks for itself. Compassionate care, we know that that's when someone is not doing well in long-term care and they need to see their family or their friends. Essential caregiver, in part the brainchild of Face for Seniors. This is when you designate someone who can come in and visit, and they can come in once or twice a week. They have to provide some level of care, okay? And then the final is social indoor visitation. And this is something that has been pretty severely limited until recently, until this new visitation came out. So all of these things are enabled under this resumption of services executive directive that we've been living under for the last year. I should say that this visitation memo supersedes this executive directive only when it comes to visitation. We can move to the next slide.
And Lori, I just wanted to say, because I know all of Face for Seniors members would want me to say this, that the term social visits is the term that we use to describe that 4th category of visits. We don't like the word social. We believe that as family members, we serve a purpose that's much beyond social interaction alone. But I'll just say that as you move on and talk about the faces.
Right, and understand that, and I will get into this later, but it's not a family member who's providing care. So I was trying to figure out a way to not just say indoor visitation. So
I understand.
did struggle with what to call it, but and I don't mean to minimize it. So the I feel like I have to cover the phases that are in the executive directive, because families will often hear from long-term care administrators, hey, we're in phase 0. We can't do any visitation. So these phases are in the executive directive, which is again superseded by the visitation memo. Phase 0 is kind of where everybody started. There really isn't anything but your end of life, compassionate care visits, and essential caregivers if there has not been a new case in 14 days. Phase 1 is when you're out of outbreak and you've made certain attestations to the Department of Health around PPE and testing and staffing and things like that. And in phase 1, you can actually start to have some very limited communal activities. It isn't until you get to phase 2 that you can have social indoor visitation that is not a compassionate care visit, that is not a caregiver, an essential caregiver visit. And a lot of facilities were actually at phase 2, like during the summer, but went back out of it, went back into outbreak when we had another surge in the late fall and are into the early winter. Phase 3 is things pretty much open up, but New Jersey has not gotten there as of yet. So I do want to emphasize that with the new visitation memo, visitation is allowed in every phase except for COVID positive residents or units. Okay, can only be paused if there's.
Go back a page. So I just want to clarify for this because I see the questions. It can be confusing because you see phases, which implies things changing as the phases progress. But the note at the bottom is the most important note on this page, which is that with the new visitation memo, visitation is allowed in any phase. Just want to make sure everybody understands that, because there's some questions about outdoor visits and such. Visitation is allowed in any phase. That's what Lori says. That's what the DOH says. There's just some other nuances to the phases that might affect other things. Okay, go back to you.
Thanks for that. Thank you. Next slide, please. Okay, so what's new with this new visitation memo and the new quarantine guidance for outings? First of all, the core value is that every long-term care resident has a right to social indoor visits, for lack of another term. So this should include any one of the residents choosing, and this could include grandchildren, and we'll get to that later. And it's new and it's comprehensive, and only residents who have COVID-19 or who are in quarantine are not eligible. Okay, again, can happen in phase 0, and we'll explain why later. And this is the other very new piece of this, is that you can have a positive case in one section, right? And it doesn't shut the whole facility down for 28 days. How often have we heard, nope, we're not through the 28-day period yet, right? Instead, visitation is suspended when there's a positive case and they do outbreak testing. And if they find that it isn't identified in other areas, right, then they can resume visitation in those areas. And this is new too, the affected unit doesn't have to go a full 28 days either. If they go 14 days without another positive test, they can reopen as well. So another huge thing, right? Vaccinated, masked residents can hug and touch their masked visitors. Power of touch. Okay, so the other thing that's new is that quarantine is only required for vaccinated residents if they have known prolonged, that's 15 minutes or more, exposure to someone who has COVID-19. So let's move to what's not.
So I just want to back a slide. So I know, Laura, you can't speak and follow the chat, but many of the chat questions are actually answered from what's on this page. So the last one, quarantine is only required for vaccinated residents if they had prolonged exposure to someone while they're out and away. So that answers the question of like, why do I have to quarantine my loved one when they come out? It's only if they've had prolonged exposure to someone. And I know, Laura, you're going to talk more about that.
I am going to talk more about that later, especially if they're fully vaccinated.
And then there's the question about the outbreak, which you're going to speak about. Why is an outbreak one case? And then you're going to speak about that
specifically to that. Yeah.
Okay.
So what has not changed? Well, what's not changed is that you still have to schedule a visit. So the CMS guidance, the federal guidance, came out on March 10th. And I should note that New Jersey's guidance cannot go beyond what the federal government allows. And on March 10th, the federal government changed its visitation guidance, which had not been updated since last year. I'm pretty sure it had not been updated since October or something, September 17th of 2020. And so some of the things that the feds changed were significant, and we just talked about them, but some of the things they didn't change. They still say that long-term care facilities should probably schedule visits because they need to control the number of people who are coming in, and they have to have adequate staffing and supplies. They still say, and this is important, all visitors still need to be screened and wearing masks, right? But they still allow compassionate care visits as an essential caregiver. And I want to really emphasize this because we're already getting a lot of families calling us saying, oh, well, the administrator said, I don't need to do essential caregiver visits now because now we can do scheduled indoor visitation. That's not actually true. Compassionate care is still there. It still exists. And so is essential caregiver, and they are not interchangeable. Next slide. So one of the questions we want to know, when is this effective? The answer is now. It is effective now. The New Jersey Department of Health visitation memo came out on March 22nd. It did take, and we did urge people to give the facilities a little time to figure this out. But at this point, it's April 15th. If they are not doing outbreak testing, they should have a scheduling system set up, and we'll get into a little more around that. But you know, a lot of long-term care facilities are actively communicating with their families and their residents about what types of visits are allowed, and they're being really upfront about it. Where we get calls are when the long-term care facilities are not communicating and basically like sticking their head in the sand and pretending this isn't actually happening. I don't have to let families in. And you know, some of them just are really, really fearful, and we understand that. But this is effective now, and they need to.
So, Lori, there's a couple of questions, one from Merrill, one from Brian, that ask exactly what you just answered. They said, what are we supposed to do when the facility is not even following the guidance? What if they're ignoring it? Do they have to follow the guidance? I think the answer is that we call you, right? We go to the long-term care.
Yeah, you call me, and I mean, I don't know if Cassie wants to chime in, but if it's a real problematic situation, I'm gonna pitch it to Cassie, and Cassie will make a call.
Right.
Okay. And say, you know, try to say, what are you doing here? You know,
right.
And again, I think sometimes they just don't understand it. And there are a lot of moving parts to this. You'll see, guys, when we get to the end, there's like a ton of resources. There's the executive directive, there's the memo, there's the risk assessment. You know, there's a lot of guidance out there that everybody's trying to juggle. And our phone number is there, and you can definitely call us. So let's move on to visitation eligibility basics, okay? Why do indoor social visits stop when a staff member tests positive? Okay, so that's because COVID-19 is still, you know, a risk. So anytime there is, and this really want to get clarity on this because I was confused about it. Every time there is one positive test result among staff or residents, the facility must start testing everyone in the facility. During that time, visitation will be temporarily paused until the facility can figure out if anyone else was exposed. So even if one staff person tests positive, a round of what's called investigation testing begins. This testing may still be referred to as outbreak testing by the facilities due to the language in the executive directive. If two staff test positive, it is considered an official outbreak by the local Department of Health. And the outbreak testing must occur. So for those of us who are talking about visitation, this is a distinction without a difference, because the bottom line is whether you're doing investigation testing, which is one staff person, or you're doing an outbreak testing, which is two staff people or one resident, and it appears to be facility acquired by the resident, then you're doing the same thing. You're doing testing and you're stopping the indoor social visitation, but you are doing end of life, you are doing compassionate care. You are also pausing, unfortunately, essential caregiver visits.
So this is a case where words matter. And unfortunately, the word outbreak connotes something very different than the word investigation. But what you're making clear for us to understand is when there's one case, there's an investigation, but the language often refers to that also as an outbreak, which makes me panic, but it's not actually an outbreak. It's a case being investigated, right?
Right, but
yeah.
The same effect in terms of visitation.
But the same effect on visitation.
If there's anybody from health wants to jump in here, but it's basically when we're talking about visitation, if you're investigating or you're still testing, you're still waiting to find out. So we get to the next part, which is what is an outbreak? What is outbreak testing? Okay, so again, the definition of an outbreak is one or more facility onset case in a resident, which means a confirmed diagnosis in a resident that was not admitted within the last 14 days, or when 2 or more staff receive a lab confirmed diagnosis within a 14-day period. So whether it's for an investigation, which is 1 staff positive, or an outbreak, 2 staff positive, or 1 resident positive, when a new case of COVID-19 is identified, immediately facility level testing must start, right? So everything stops.
I want to address some of these questions as they come in, and there's so many. So Abby asked a question. This is confusing because you just said visitation in all stages, except that's not true. Why say visitation in all stages? I think that you're saying that when there is an investigation or an outbreak, that does affect visitation.
Yes, and I did say that when I was talking about the phases, okay?
Yeah.
So yes, it's available in all phases, but when you have a positive case, you either start investigative testing or you start outbreak testing. And the federal guidance says when you are doing that outbreak testing, you have to pause visitation. That's not the state of New Jersey saying that. That's the federal government that says, well, until you assess that it has not expanded to other areas of the facility, you have to stop everything. Now, the good news is you can use a rapid test, right? It's permissible under the Department of Health guidance. So if you use the rapid test, you may be able to figure out that you don't have a spread of the virus in the facility, and then you can start to restart indoor social visitation in those areas of the facility where you have not had another positive test. And even in the affected area, if you haven't had enough, if you don't have a positive test for 14 days, you can start again. And again, that's different because under those phases, I understand that there's 2 separate things going on here. And that's why I said in the beginning, the visitation memo supersedes the executive directive when it comes to visitation. This is new. This is why we're talking about it. But I felt the need to go through the phases because this is something that facilities say. So when they say to you, we're in phase 0, we can't have indoor social visitation, you say to them, have you had a positive test in 14 days? If they say no, then you say, then you should be scheduling indoor social visitation.
Great.
Any questions more in that area?
No, I think maybe some more questions. Keep going.
Okay, so again, I addressed the phase 0 and I told you what to do. The Cali score, how does that affect the visit? Because that gets brought up and used for a lot of reasons. Oh, we can't do this because we're severe. We can't do that because we're severe. The Cali score at this point, in terms of visitation, only affects unvaccinated residents, right? Because the visitation memo states that all vaccinated residents have a right to visitors as long as the resident is not COVID-19 positive or in quarantine. Unvaccinated residents also have a right to have visitors. However, if unvaccinated residents live in a facility where 1, the Cali score is very high, or where fewer than 70% of the residents are vaccinated, they may not be able to have indoor social visitations. But both of these conditions must be met. The other thing to know is that if the long-term care facility has a rehab section where they have short-term, they are only counting the long-term care residents for the purposes of determining the percentage of residents who are vaccinated. And that's very important because a lot of people cycling into and out of the short-term care for rehab may not be vaccinated, whereas most residents of long-term care are vaccinated.
Yeah.
So moving on to visitation. So the question is, can I drop in and visit now? And the answer to that is no, you probably can't do that for the reasons that I talked about earlier. I mean, the facilities may be scheduling these visits. The federal guidance gives them the latitude to do that, and the state guidance does as well, because we still recognize that COVID-19 is a risk. And so we need to control the number of people who are going in and out of the facility, need to have proper screening, need to set aside in some cases proper visitation areas and have the ability to clean them after each use. So you really need to work with, I think this is going to be a common theme here today, which is talk to your long-term care facility, tell them what you think the resident needs. It's all about the resident, what kind of visitation is needed, how long, that type of thing, see what you can work out. But the facility should have a plan by now for how they're going to accommodate social indoor visitation. So why do you schedule a visit? It's kind of the same question, because the federal government allows them to do that, because they have to have the staffing, the PPE, testing, the area set aside, that type of thing. Can I visit on evenings or weekends? We get this question a lot. And, under federal law, the resident is entitled to visitors of their choosing, right? So the long-term care facility should allow you to visit during these times. Again, they may be scheduled, but they really should have a schedule that will allow for people who work full-time to be able to have these types of visits. So your facility may be using a scheduling system, so you should inform them proactively. Here are the hours when I will be able to visit. So what is your plan to accommodate those of us who work? When I say work, I mean work a traditional like banker's hours, Monday through Friday work day. So they should have weekend hours, and they should.
So Lori, what does somebody do? Because there are questions where people are saying there's no weekends, there's no nights. Do they state their case to their facility, they say nope, and then they go to the long-term care ombudsman?
Yeah, and they come to us. Cassie, don't you support that position?
I do. Hi, everybody. Good afternoon. This is Cassie Goloszewski from the Department of Health. There has to be a reasonable accommodation for evenings and weekends. I work full-time like most of you, and I would want to go see my mom or dad on the weekends or after work. So you would in fact reach out to Lori and the Ombudsman group, and if she were not able to get a response, then the Department of Health would reach out to the centers. And we have heard you, and we have responded to those kind of requests and calls. So I think it's getting better. I do get less calls on this every single day now that the centers are beefing up and really getting their visitation in order. So yes,
Thank you.
can reach out to the Ombudsman.
I do agree that it's better. So the other question is, how many can visit at a time? And again, this falls in the area of kind of discretion and common sense by the long-term care facility. We are hearing that, it's limited to 2 people. Sometimes we're hearing it's limited to 2 people outside, which I'm not sure that I understand that, but the memo does not limit how many visitors can be permitted at a time. I've seen people with 3 or 4, 5 people out in outdoor visits. Indoor visits, I think you're going to see more limitation. Again, the facilities kind of have the discretion to do that. But again, talk to the facility and say, look, here's who we want to bring in. Would it be okay if we did 3? Try to work with them. And if you think that they're being unreasonable, then of course come to us and we may end up going to Cassie. But they do have the ability to put those kind of limits in place because COVID is still an issue, because they need to have adequate staffing, PPE, all of that in order to accommodate. So another question that we get a lot is, can the facility use short staffing as a reason not to do the indoor social visits or to severely limit them? And so, my reaction to that is that the facilities are required to have enough staff to care for the residents and to accommodate social indoor visitation. Also, important point, one-on-one supervision, having a staff person sitting there with you, which I've heard happens, is almost never really necessary, especially for a fully vaccinated resident and for someone who is not taking their mask off all the time. So lack of staffing should generally not be considered a reason to deny visitation. However, depending on the resident's living situation, you may need to schedule your visit, as we talked about earlier. So again, discuss your visitation needs, what you think the resident needs, what works well for them with the administration. So you can all make an informed decision about how to conduct a safe visit. I can hear myself suddenly. I do want to say this. They can't continually use that as an excuse, okay? This has been out for 3 weeks. We know that staffing is an issue, but you don't have to have one. You just have to be able to get eyeballs on, get people screened and get them in. So really, if this feels to you like this is just an excuse and being obstructive, or that they truly don't have enough staff in that facility, that's something the Department of Health wants to know about. And FAQ when we release it after this meeting. You'll see the email to email them or contact them and say, look, I think there's a staffing issue here.
Yeah, I just want to say two things. One is that Amy Brown is answering a lot of questions in the chat box, which is extremely helpful. And Amy works with Lori in the long-term care ombudsman's office. It's hard to tell where people are from in the chat. So Amy is from the long-term care ombudsman's office. If she answers a question, that's an official answer. And then also Kaylee works in the governor's office, and she's also answering some questions in the chat. She's from the governor's office, so those answers are official as well. Tons of questions about unvaccinated staff. We're going to get to that. It is the hot topic. I just wanted to let everybody know we will get to the question of unvaccinated staff. Okay.
Thanks, Bill. Okay, so here's some quick and easy ones. Must all visitors be tested or vaccinated? No. Obviously, we want people to get vaccinated. You know, we want people to agree to be tested, but under the federal guidance and the state guidance, not required. Can a long-term care facility keep me from visiting my loved one because they don't have enough rapid tests? No, they can't do that because you don't have to be tested. Can children now visit long-term care facilities? The answer is yes, but they need to be over the age of 2. They need to be able to wear a well-fitting mask and abide by social distancing requirements. They must be supervised by an adult at all time. That's a common sense thing. You don't want a kid that's going to run all over the facility. And I know that's tough, but yes, the grandchildren can visit. Can I visit in my loved one's room? So if your loved one is in their own room, there really isn't, and for essential and compassionate care, absolutely yes. For social indoor visitation, if they have their own room, they really should accommodate you in the room, unless there's some bizarre reason why they can't do it. But if your loved one has a roommate, that is not as clean a shot. Like, you probably are going to have to do it in a separate area. Unless there's like a unique situation where you can get both roommates to agree. And that's, but that's probably going to happen in another area. So we're going to get to the next part, which is my sibling is visiting out of state. Can they visit in my, I'm sorry, go back. Go ahead. Are we on?
That's there. That's at the bottom of that page.
Okay. So my sibling is visiting from out of state. Can they visit my parent indoors, outdoors? This just changed, but not like a ton. The guidance on this is continually changing. At this point, if you are fully vaccinated and asymptomatic, you do not need to quarantine if you are coming from out of state for a visit with a loved one in a long-term care facility. Okay. However, if you are unvaccinated, you are required to quarantine before visiting if you are not coming from neighboring states of New York, Connecticut, Delaware, or Pennsylvania, or you don't meet other exceptions that are outlined in the current travel restrictions. And those restrictions are listed in the link to the FAQ when we end this and we post it. So what about family coming into out of state for end of life visits? Can those visits be scheduled indoor? This is one of those areas where I think most facilities are being very accommodating on end of life, because for crying out loud, it's end of life. You may not see this person again, but the facility should work with the family to facilitate safe indoor visits when the resident is nearing end of life, regardless of the vaccination status of the resident or of the visitors. It may have to be definitely a separate room or a separate area, but obviously you need to be the long-term care facilities really need to be flexible in this area, because we only get complaints. I only hear about the situations where they're rushing the family out while mom is actively dying. We don't want to hear that. That's inhumane. And so I think most facilities understand that a special accommodation needs to be made in these situations.
Lori, two quick things. There's a question about pets. I've never really thought about this one. Bringing in a pet to visit a
I saw that, and I don't know if Rebecca wants to opine on that issue. I'm sorry I didn't include it.
Rebecca, is there any policy about bringing a pet in? I know this is maybe a narrow kind of issue, but.
We've gotten a couple. Hi, I'm Rebecca Greeley from the Communicable Disease Service at the Health Department. I think we're going to have to loop back on the pets. I've only seen a couple of questions come in over the past, 9 months with regards to pets. I would say the short answer is no. But again, I'm going to have to probably get back to you on that one.
Right.
We've gotten some questions about service animals and healthcare facilities. So I don't know what the context of the pet would be, if it's specific for an end of life visit versus a social visit. So
Okay.
I think we'll have to get back to you on that one.
Thank you.
Thanks, Rebecca. And this is going to be an ongoing process. We're going to post this FAQ today, but we will update it. You know, we can easily do that. You know, someone did ask a question about bedridden residents. Obviously, if someone's bedridden, there's going to need to be an accommodation made to safely do visitation with them in their room. So if there's an issue there, definitely call our office. You're not going to want to, you know, traumatize or disrupt a resident who is bedridden. So getting to the, can I hug my vaccinated loved one? Why do I have to abide? I can hug my loved one. Why do I have to abide by social visitation, social distancing? So basically, you know, we do know, again, to reiterate, there is still some risk, but the protocols are in place to minimize the risk. And for this reason, all visitors really, it's most important that they wear a well-fitting mask 100% of the time, do the hand hygiene, and do the social distancing as much as you possibly can. Okay, that's kind of the guidance on that. Can a person have more than one person designated as their essential caregiver or more than one person for compassionate care? The answer to that is yes. That is actually in the executive directive. They can designate more than one person, and the facility should work with the resident and the family to work out a schedule to accommodate both essential caregiver and people who are approved to make compassionate care visits. It can be more than one. The other question that we often get is, how does the visitation memo impact outdoor visits? Are they still required? Is social distancing required? This is an example where the executive directive and the memo don't totally agree. So outdoor visits are permitted for all residents except those who are COVID-19 positive or in quarantine. In fact, outdoor visits, and this is in the federal and the state gardens, are actually encouraged, and facilities should provide ample, comfortable space for these visits and should schedule them during hours that are convenient for potential visitors. We get this a lot. We have had facilities that set up tents and are very accommodating, and we have others that set up like a card table by the highway, and it's noisy, and it's not really a serious attempt at allowing outdoor visitation. We want to know about those situations, want to work with those facilities.
And you can bring kids when you have outdoor visits, right?
Yes, you can bring kids for outdoor visits. You can touch a fully vaccinated resident for an outdoor visit. Staff need to be able to kind of see what's going on, but they don't need to be sitting there with you one-on-one. I know there was a lot of that going on when we first did outdoor visits, but that isn't really. And the other thing that I would say to administrators is, don't put too many restrictions on outdoor visitation, because it really is a good substitute for indoor visitations, right, especially during these warmer months coming up and these beautiful days that hopefully we will have, other than like today.
And if there's an investigation of a positive case, an outdoor visit is still permitted, or no?
Yes, outdoor visits are permitted.
Okay. And I just want to clarify, to catch up with some of the questions, we will be sharing this PowerPoint. It'll come from Lori, and we'll also be sharing a Q&A document. So if anybody's worried about missing things, we'll get to that. And then, yeah, that's it. Back to you.
Lori, can I just say one thing? So an outdoor visit, except when a patient is positive, okay, or there's been exposure. I just want to make sure we make that distinction.
Right. Yeah. Thank you, Cassie. Okay, so yeah, you don't need to be chaperoned. So we'll end with that, and moving on to resident freedom within the facility. This is kind of a big issue. I mean, we still get, again, I really need to point out that we only get the cases where things aren't working out. So I can't tell you about all the wonderful things that are actually going on out there. I am seeing them on the Face for Seniors page, but you know, we get the stuff when it ain't working out, it comes to the Ombudsman's office. So we are seeing facilities that are still making people stay in their rooms. Okay, and they don't need to make them stay in their rooms for weeks on end, regardless of fees. So why do residents have to stay in their room for weeks on end? They don't. Nothing in the DOH guidance requires that residents stay in their room except where there are active cases in the area of the facility in which they reside. Even when a facility is conducting outbreak testing, residents, except those who are COVID-19 positive or are in quarantine, can leave their rooms for short periods of time or be escorted around the facility grounds to get some fresh air. Under the existing guidance, group activities can be limited and residents can be encouraged to stay in their rooms. So then you wonder, why isn't my facility hosting any group activities or meals? And this gets back to the darn phasing system, where the communal activities and meals don't really start until phase 1 or phase 2, right? However, as indicated previously, the DOH is revisiting these phases. They're looking at this executive directive again, okay? So there may be changes coming down the road on this issue. And this is being done in light of the fact that so many residents are fully vaccinated. And the last time that the executive directive was updated and the phases were revisited was, in January 6th, and we had just gotten done all of the clinics. We're just starting actually all of the clinics for vaccination that were done in long-term care. So there's no reason why a fully vaccinated resident cannot leave his or her room individually or be permitted to gather in very small groups in very large communal areas, inside and outside, separated by at least 3 feet, 6 feet, and wearing a mask at all times. So facilities should try to develop strategies to allow residents to spend time with each other in the safest way possible, like doing the resident council meetings, do it in a big room. We are actually going in and doing residents' rights bingo, just with very small groups in large areas, just to get some activities done. Other facilities are doing activities great, but these are for the ones that we think need it. So again, as part of the work, we think the Department of Health will be revisiting this as more people get vaccinated. So why can't the facility open the hair salon? So beauticians and barbers who come in from the outside are currently considered outside contractors according to the existing executive directive, which again, we all hope is going to be changed. And in that, as an outside contractor, they're not actually really allowed back in until phase 2. So if you're in a facility that is doing outbreak testing or is on that outbreak list that we talked about, that you can look up on the Department of Health long-term care landing page, if they're in outbreak status, then they're probably not going to allow outside contractors in. I know that some people have taken their loved one out safely to get their hair done, but generally speaking, they're not allowed into the long-term care facilities until that facility is at phase 2. So I don't know if you want to say anything on that, Cassie, but can you confirm this is something that this Department of Health is looking at?
Yes, we are. We are absolutely. Well, we constantly with our communicable disease team, as well as the CDC directives, we follow the science. And whatever the science tells us, when we're ready, then we do it. Now, with that said, there are some exceptions that we need to be mindful of with the state of New Jersey. And that is, we have a very dense state. So we're always, and we were hit very hard. These long-term care centers were hit very hard, as well as our residents and staff by COVID. So we have to err on the side of safety. So right now, we look at everything and everything is scrutinized and re-scrutinized.
Right, understood.
Just to speak from a family member's perspective, and Karen has a post here on the chat. A lot of us feel that getting your hair cut is like getting your toenails cut or your fingernails cut. It's essential part of care. It's an essential part of life. So when we get all excited about hair care, it's less the vanity and more the pride in being human and taking care of yourself. You know what I mean? So I guess we're hoping that when it gets to issues such as the hairdresser issue, that maybe we can settle that in a way that follows the science, but also addresses the humanity of the situation. So I guess you understand that. All right.
Can I ask a question?
Is that we weren't going to take any verbal questions because we're still going through the document. We have a little bit to go. Can you post your question, or I don't know if you're unable to type into the chat. Maybe we continue to go, Lori.
Yeah, let's try to get through all this, and then we will. By the way, we print out and scrutinize the chat and try to make sure that for the next round we are actually answering these questions if there's anything that we missed today. So Can my loved one visit with a friend in another room? Yes, generally, I mean, this is the case. Residents who are eligible for for indoor social, outside social, eligible for inside social visitation should be able to visit with each other as a result of this memo, right? It depends though on whether they're in a unit that's being investigated or a unit that is an affected unit. That may affect the ability of one resident to go visit another resident in another part of the facility. But if they're not in the affected unit, visiting your friend in another room should certainly be subject to the same criteria as having an indoor visit with family. So I think this is a really important section that we need to get to, and that is the quarantine rules for residents. The question we often get was, why does my loved one have to quarantine every time they leave the facility? And this is a big change. Residents may not have to quarantine every time they return to the facility, especially if they are fully vaccinated. The CDC and the CDS, of which Rebecca is a part, have changed the requirements on this. So the CDC recently stated that fully vaccinated residents who are new admissions or existing residents who go out of the facility for any period of time or for overnight do not necessarily have to quarantine upon their return if they have not had prolonged close contact with a suspected or confirmed case. So when you get this FAQ, you will see a link to this risk assessment tool. And in that risk assessment, there's actually a decision tree that shows how decisions are made for fully vaccinated residents, okay? The CDC defines prolonged close contact as 15 cumulative minutes of exposure at a distance of less than 6 feet to an affected person during a 24-hour period. So for unvaccinated residents, in situations where residents need to routinely leave the facility, like go to a doctor's appointment, dialysis treatments, outpatient procedures, the facility should utilize the risk assessment tool that I talked about that you can link to. The risk assessment should include factors such as community transmission, infection prevention, and control compliance for transporting the person, and the presence of COVID-19 cases in wherever they're going, right? The CALI score, again, here is not solely determinative in terms of whether you need to quarantine when you come back. And we do get that, where there are facilities that are saying, well, we're in severe CALI, so if you leave, you come back, you got to quarantine. That's not true. There is actually, for unvaccinated residents, there is a risk assessment, and they really need to look at where did you go, what happened, how were you conveyed, was social distancing adhered to, were masks adhered to. So again, there's a link to all of this, but that definitely means that fully vaccinated residents. So what we really need to do here, again, is talk to the long-term care facility, be honest about what you're planning to do if you do take your loved one out. The holiday visitation guidance that Cassie put together, that was put out for all of the upcoming Mother's Day, Father's Day, all the holidays coming up. We don't want a ton of people going out because we are still in, I believe, high to severe in many of the counties in New Jersey. So you have to be really careful. But again, talk to the administration about what you want to do, and try to do it as safely as possible, especially for unvaccinated residents, which really is probably not a good idea to take them out, but for fully vaccinated as well. Another question we get is, my loved one's on dialysis and is constantly in quarantine. Does this mean they cannot have any indoor social visits? So CDC also kind of changed their tune on this, and New Jersey has adapted it as well. If a resident is fully vaccinated and has not had contact with a suspected or confirmed case of COVID-19, the resident does not need to automatically quarantine. Indeed, the CDC recently stated that the adverse impact of continual social isolation outweighs the benefit of quarantine. So for unvaccinated residents, the facility should be using the same risk assessment that I just discussed. The facility should work with residents to try to accommodate their right to have visitors of their choice. And if they don't, that's when you call us. Any questions on that section, Bill? So this is like the topic of the hour, because we know that that there's a higher percentage of residents who are vaccinated than there are of staff. And we do know that most of the investigations of the outbreak testing that's being done is often because of staff positive cases. So the question is, and I'm going to let Cassie handle this, I mean, or I'm going to defer to her, but basically, why isn't the state requiring long-term care staff to get vaccinated? And can private companies require their staff to get vaccinated?
So I'll answer the last question first, and that is yes, private companies can mandate that their employees get vaccinated. The state of New Jersey is not mandating any of our staff in these long-term care centers to be vaccinated for many reasons. But first, there's a lot of hesitancy about taking vaccinations in the general public, not just in the nursing homes. There's some fear, and I think with a lot of the outreach that the Department of Health has been doing, as well as a lot of good work in some of these nursing homes to get their employees vaccinated. They've had their medical directors speak to their staff. They've had all kinds of outreaches within their particular centers. So this is something we are watching very closely, but there's more to this. And apparently we are not alone.
No.
There are no other states that I'm aware of that have mandated for their healthcare staff to be vaccinated. So there's where it stands right now. I can tell you that we feel this is improving slowly but surely, just like the general public numbers are improving slowly but surely.
Right. Yes, and that is true. No other state is mandating it as well. And so the vaccination rate among residents is low. We get that question. And they say, why isn't DOH doing something about this? Well, they are, Cassie. I mean, there's a lot of like outreach going on to the long-term care space, to the staff. There's like some culturally appropriate outreach that's going on. I know a lot of peer-to-peer kind of.
You mean this? You said residents low. You mean staff is low?
I'm
right?
sorry, staff is low. Yeah, lower. But Cassie also, I can confirm that the Department of Health. Now, this is the J&J issue has thrown a little bit of a monkey wrench into this, to be honest. But there is vaccine being distributed through long-term care pharmacies that is being made available as part of a vaccine maintenance program. So just so you all know, as family members, that there were clinics at your long-term care facilities, usually 3 of them. They occurred like in December and January and into February. They're all done now. And there's a need for more vaccination, whether it's a staff person who didn't want it before and wants it now, or a new admission, a resident who's recently in there. So there is an effort, there is vaccine set aside for this purpose. And so I do want to get to really the end of our program, and Bill can shoot some.
I do have some more questions, so finish up. Go to the question.
Okay, so I do see, like, somebody on the chat said, I don't think that these facilities are doing this. What do we do? Like, what kind of enforcement is there for facilities that choose not to do it? Well, Cassie and I both like to take the approach of reaching out directly to the long-term care facility and say, what are you thinking? Like, what's going on? Like, here's what it says in the guidance. What's happening in your facility? Let's see what we can work out. Obviously, if a facility is saying, no, we're not going to follow this memo, we're not going to follow this quarantine guidance that's been put out by the Department of Health and is informed by the federal government, then that's really when, we're advocates in the Ombudsman's office. We're not enforcement, we're not regulatory. So it's at that point that we're going to refer to the Department of Health. And that may not just be sending it to Cassie, because I don't want to overload Cassie. She's got a lot on her plate. But, we may make an actual referral in writing to the Department of Health for enforcement. And so that's really, we try to avoid that, but they are required to follow these executive directives. They're required to follow the federal nursing home regulations, the state assisted living regulations, and they're all supposed to follow this new visitation memo and the quarantine. And so what are the remedies that the Department of Health has? Well, they can issue a deficiency and there could ultimately be fines and that type of thing. But we really try to work this stuff out before we get to that point. So Bill, go ahead. Do you have anything?
Okay, so there's a lot of people that posted, in my situation, this is happening and this doesn't seem right. And based on my understanding of what Lori is saying, what you described doesn't seem right to me either. So you're understanding Lori correctly. What your facility might be doing isn't quite right. So that's when you follow this page, enforcement. and reach out to the ombudsman. Priests and religious people coming in as support, important part of life. Is there any policy around that? Priests, they would be considered to be visitors, social visitors, I suppose. So they should be able to get into the facility, right?
Yeah, I think they're also allowed as compassionate care.
Compassionate care. I mean, okay, so, all right. There was a question about having to wear goggles, very specific question. I don't believe anyone needs to wear goggles when they visit, is it right?
Well, eyewear is required for certain situations. Rebecca, I think you can probably opine on that.
In addition to a face mask, a goggle?
Now, this is, a face mask is the only thing that's required for visitors that I know of, for outside visitors. I believe that there was a recent requirement for staff to have eyewear in COVID positive units. Do you know if that's true, Rebecca or Cassie?
Couple of things got blurred there. Staff have to wear universal eye protection,
Yeah.
right? So, and then if definitely if they're on a COVID positive unit, they have full PPE.
Yeah.
With regards to eyewear and visitors, I mean, the most important thing is going to be that well-fitting face mask.
Right. Right.
So, all right, so no to goggles for a visitor, am I right? I think that was correct.
Required.
Okay, hopefully you can all still hear me okay. Kaylee answered a question about facilities receiving training from the Department of Health, and the answer is yes to that. That was a good question. Just what
Well, I did cross through that. I mean, there was a webinar similar to this done with the providers.
yes.
And I think that Cassie has put together an FAQ for them. And I think there's probably going to be more education going on, right, Cassie, to the long-term care facilities. While we think it's getting better, we still have a lot of questions.
Yes, in addition to our communicable disease team being on that call with all of the providers, the long-term care centers, the assisted livings. We also had both our deputy commissioners on there, as well as myself. And basically that we walked through this document, just like we're doing pretty much today, with a little bit more technical detail pushed in there. But every one of the centers were in fact given this notice, and all of the centers are aware of this, this new directive.
There was a question about anonymous contacts to the long-term care ombudsman, meaning not sharing the name. We have to share the name of the facility, but the name of the resident. And I think Amy answered that question saying that, that you can make a query.
We do. What we do is a workaround. If we don't have a resident to call about or visit about, we call them and say, okay, what's your visitation policy? What are you doing? And then try to feel them out and educate them while we're on the phone. Right.
And then there was sort of just a little bit of question around the nuance around the outdoor visits. And I'm going to actually just ask it myself. If not outdoor visits, taking a resident out. So in my case, my mother is ambulatory. She walks fine. She just can't see. I take her out. I filled out, when I got back, they did a risk assessment in terms of what we did. We basically drove around in the car. That was safe. I'm vaccinated. She's vaccinated. No quarantine. So, and that is generally what should happen, right? There should be a risk assessment upon return, and that should determine whether or not the resident goes into quarantine or not after this outdoor activity. Is that right? I mean, am I oversimplifying it?
That's correct. The risk assessment is really meant to be patient-centric. The big change with residents leaving is the vaccination status of the resident, right? And so that assessment should be done, and it should be an active communication with the family, or who's visiting or who's taking that resident out, and the facility. It's not meant to be a blanket, and it never really was. Anybody leaves the facility is automatically quarantined. It's really meant to walk through a back and forth with what happened, where was the resident, that sort of a thing.
Right. Okay. Thank you. And then there's questions about duration of visits. Now, I know in my case, where the facility where my mom is does have guidelines about duration, but I don't know the broad policy about duration of a compassionate care visit, of an essential caregiver visit, of what we call social indoor visits. Can you talk to duration?
I think I can take that. And basically, staffing is a big part of what the centers are doing when it comes to visitation. And one of the things when we had Our meetings with the staff, with the centers, we really reinforce that. You have to have the staff to be able to monitor what's going on in the building so that we don't have folks wandering into areas that they shouldn't. So to answer your question, Bill, it's really up to the center, but, and this is really very relevant. If there is absolutely no reason to limit the amount of visitation, unless there's a big influx of visitors that want to come in on that particular time. And I'll give you a good example of that. I received a call last week from a family member that was limited to a half hour, and it was 5 o'clock on Friday afternoon. So when I called the center had a multiple influx of visitors that time frame. So they were trying to squeeze everybody in a brief amount of time. So some of that is just common sense. And it just, you know, we need to be mindful of that. Lori said multiple times on this call, go back to the administration in the building and really confirm. And if the answer you get doesn't make sense, then you reach out to Lori or to the Department of Health. So I think I answered your question, Bill.
Yeah, thank you. It is a tough one. So we're at the end of our time. I'm going to say just one thing, and then I'll turn it over to Lori for the official thank you and goodbye. My goal was to make this webinar, and I'm grateful to the Department of Health, to the Long-Term Care Ombudsman's Office, and to all the members of Face for Seniors on Facebook, that we made this a richer, more helpful conversation. And I'm grateful to all the work to get the commonly asked questions down on paper, get the answers prepared so that we can work quickly through this. I think we did a better job with the chat. Chat's really hard, but thank you to Kaylee and to Amy for answering some questions, because we used this hour really productively. I think that this is not the last hour together. I think we are going to continue to collect questions. We're going to have more webinars until we get through this. But I just am feeling, and I hope everyone's feeling good, that we did a better job at answering questions so that we can be better advocates for our loved ones and fight when we need to fight on behalf of those we love. Okay, and I'll turn it over to you, Lori, for your final word.
Thanks so much, Bill. And I, again, appreciate the opportunity to do this. We want to keep this dialogue going. I really appreciate so much my colleagues at the Department of Health for looking at various drafts of this and making sure that we got the FAQ just right. And I really appreciate the governor's office recognizing how important it is to engage families and residents in this ongoing discussion. One of the things that I talked about with Bill is maybe we should do a Facebook Live at some point for the Face for Seniors group. This is always a moving target. Things are always changing. The Department of Health is continually trying to figure out, how to balance safety and autonomy, right? For residents in long-term care. We have a social isolation program that I have started as a result of COVID-19. I have staff and social workers going out into long-term care facilities to see how residents are doing after these many months of isolation. Please feel free to let us know if you're having any issues or problems. I know that the Department of Health stands behind the Ombudsman's office when the facility is not doing the right thing or following the regulation. But I will say that I think many of them are really trying to do it. I see a lot of positive stories. A question came in from a provider who said, who can we call with questions? You can call me and you can contact Cassie as well. I mean, the Department of Health and the Long-Term Care Ombudsman are available to answer questions from administrators because they're juggling an awfully lot right now. And you're juggling a lot in wanting to get out there and see your family member and make sure that they're doing well after this terrible ordeal. So thank you so much, everybody. This is just a beginning.
Thank you. Thank you to the facility administrators as well. Thank you.
Thank you, Bill. You all did a tremendous job today. We appreciate it. We look forward to the next part of this. Take care, everybody.